I'm Jeremiah A. Barondess, and it's my privilege to serve as president of Alpha Omega Alpha Honor Medical Society. I'm pleased to be able to introduce this filmed interview, one of the Leaders in American Medicine series. This series was made possible by a grant to Alpha Omega Alpha by the late Professor David Siegel and his widow, Dr. Beatrice Siegel, both distinguished physicians and both members of the faculty of the Columbia University College of Physicians and Surgeons. The idea behind the Leaders in American Medicine series is to capture something of the spirit and character of some of the great physicians and surgeons of our time. In each instance, the interview is conducted by a former student or colleague, often distinguished physicians in their own rights. I'm pleased to present a leader in American medicine.
This afternoon, it's my privilege, on behalf of the faculty of the Johns Hopkins University School of Medicine, to introduce Dr. Phil Tumulty. Phil is an admired colleague with over 50 years of service to American medicine. His career is unique. It begins when American medicine was talking about the art of medicine. It spans across the introduction of science into medicine, and in the process, Phil has a perspective and a career that has left him uniformly acclaimed here as the clinician's clinician, the teacher's teacher, and a physician of renown. Phil, those are well-meant, heartfelt remarks on the part of the faculty.
They mean a lot to me.
And we wanted to know how it is that someone like yourself really began interested in medicine and selected this for a career. I guess I want to know a little bit about your recollections of your family and your early upbringing and how it directed you towards service.
Well, Norm, my grandparents came here from Ireland. They were migrated from Ireland. They landed in Jersey City, which is, as you know, across the river from New York. And they didn't have a cent when they arrived. But they worked very, very hard. And my great-grandfather bought a little grocery store. And they gradually built the grocery store up into a bigger store. Then they bought a bunch of real estate. And they finally had a nice business going. And they had 6 sons, and they sent all of the 6 sons to law school, to Columbia Law School. And my father was one of them. And then my father got into politics, and he got to know Woodrow Wilson. And Woodrow Wilson then was elected to be governor of New Jersey, and he asked my father to become his secretary, his advisor. Father was a very good, clever politician, and he was his secretary as governor for 4 years, and then Wilson became president of the United States. And Father was invited to come to Washington to be Wilson's secretary. In those days, they had a special job called Secretary to the President, which they don't have anymore. But the Secretary to the President sort of ran the whole show. He was executive officer for the White House. He was the relationships between the President and the press were all handled by Father. All appointments were handled by Father. Relationships with Congress and so forth were all handled through Father. So he was sort of the key man in the show, and he and Wilson were just like this. And he had 6 children. I was one of them. I was the youngest. I was the baby in the family. And then I had a brother who became a lawyer, and then 4 sisters. And we had a very happy family, a very close family, an Irish Catholic family. And we had a very religious atmosphere. But religion in the sense of what religion should mean. Not a lot of bowing and needling and all this kind of thing. But Father and Mother believed keenly that there was only one way to show your feelings for God, and that was through charity. And only through helping other people could we truly express to God what kind of people we were. And Father spent his whole life partly in politics, but largely in charity. And we did an infinite number, he did an infinite number of things for charity.
Can you call one back to us, Phil? One of the things that really stands out
I can
in your
remember
mind
one.
with your dad?
When I was 9 years old, my father asked me to go to New York with him to have a nice time at the Waldorf Astoria, a nice weekend. So we got all packed up and we went down to catch the congressional train. It left at 5 o'clock. And while we were going through the great big station in Washington to get on the congressional train, we saw a policeman beating a poor old white man, just beating him terribly with his club. And Father said, "Just hold tight, son. We've got to do something here." So he went over, and Father said, "Officer, stop beating that man. You can't do that." And he said, "Go away. Leave me alone. I know what I'm doing." And Father said, "Look, you're going to stop beating that man. I'm a lawyer, and I'm going to be his lawyer." And he said to the poor man that's getting beat, he said, "Am I your lawyer?" And this poor old soul said, "Yes." So Father said, "I'm going down to the jail with you." So then he turned to me and said, "Son, we have to cancel our trip to New York City. We'll go next week, because I'm going to stay with this man till I get this worked out." So then we went down to the station house, and Father bailed him out. And then furthermore, he had him put up in a home for the homeless, and paid for the whole thing. That's the kind of thing he did constantly.
So this kind of service was just...
This kind of service was our service to God and his knowledge. And Mother was the same way. The whole family was taught to feel this way.
Did you ever make it into the White House? Did you
All the time. Oh, we used to go down to the White House and play. We used to ride. The White House had a wonderful stable in those days, and we used to go down and ride White House ponies. And then we had the Secret Service with us constantly, because we got a lot of death threats. See, Father was an Irish Catholic, and Father was the first Catholic ever to have an important job in the White House in this country, and there were a lot of anti-Catholic feelings. My father, we were assigned some naval doctors to take care of us. And I was terribly ill when I was about 5 or 6 years of age. I had nausea, vomiting, diarrhea, and terrible pain. And this young naval doctor came up to see me. He was assigned to us. And he examined me, but he couldn't make a diagnosis. And he kept coming to see me every day for 3 or 4 weeks, during which time I had nausea, vomiting, fever, and agony. And I was really in terrible shape. And Father didn't know what to do, so he got in touch with the naval admiral. And he was a famous man, Admiral Cary T. Grayson. He took care of Wilson. So he came to see me. And just between you and me, he wasn't very smart, because he couldn't make a diagnosis either. And I got sicker and sicker and sicker, and the family thought I was going to die. So Father asked a friend of his from New York, a very important political figure, who was a good pediatrician in New York City. So he gave us the name of a man, so we went up to him, see him, and he was a wonderful man, just great, very kind and thoughtful, very thorough, did a careful history, careful physical. And he made a diagnosis of ruptured appendix with an abscess in my abdomen, causing the diarrhea. And he immediately admitted me to the hospital, and they operated on me and drained this great big huge abscess. So that was how I learned what good medicine was and what bad medicine was. Then the other thing I learned about in the hospital with the nurses and the aides and the technicians and so forth, and the different doctors, I found out that there are different kinds of doctors and different kinds of nurses and technicians. They're thoughtful and supportive and helpful and wonderful ones. And then there's some that are mean and selfish and don't give you that support at all. I remember an anesthesiologist that I went to see. They had to put a tube down me. He said they wanted to anesthetize me. And I hated having anything put in my throat, and I began to cry. And I remember she said, you stop that crying, I'm going to whip you. You know, here's a little frightened child, and you say that to them instead of something comforting and supportive and helpful. So very early in life, I learned that there is good medicine and there's bad medicine, and that good medicine is not only science and technique, but it is what you do as a person, as a human being, to help and support and give strength and comfort, relief to a fellow human being.
Phil, two questions really come out of listening to this. That just one is the trappings and the power of the presidency, where a young man is there and exposed to it.
Yeah.
And how they could walk away for the kind of shabby allure that medicine had, particularly in the 1920s and 30s. And how did you do it? I mean, the politics, the appeal.
The things that appealed to me when I was young as to what I'd like to do is because of these experiences with doctors and with sickness. I wanted very badly to become a physician. But the other thing I thought about, being given the religious background I was given, and also as an area where you could give help and support and, of a personal sort, was the priesthood. I thought seriously of becoming a priest. But I couldn't stand the thought of not getting married. I couldn't stand not having married. So the priesthood was out. Then another thing I thought about was I love to build things. I like to make things. I love to build and make tree houses and all these kinds of things I used to build. I thought I'd like to be an architect or an engineer. But then when I got in high school and college, I discovered I didn't know any mathematics at all. My mathematics were terrible. So that being an architect and engineer was out. So finally I decided that the thing I wanted to be more than anything else was a physician. So I became one.
I'm next going to ask Phil, here we are in Washington, an exciting environment.
Right.
A very strong and firm family background. Where did you go to college? And
Well, I
what
went to
was
college.
it you found in college?
I went to Georgetown Preparatory School, which is out in the country outside of Washington. And then when I finished Georgetown Prep, I loved it. We had a wonderful time, terrific bunch of guys, with a lot of sports and so forth. I was never much good at sports, but I played them all, and usually ended up manager, manager of the team. And then I went to Georgetown College.
All right.
And I got an AB degree at Georgetown.
This is a challenge now. This was the era, 1930s, when it took only 2 years of pre-med college, and you could go to medical school.
That's right.
And you got a degree. Why did you do that?
Well, because I thought there was much more to a doctor than science or techniques. I still feel this way keenly. I think that a doctor is much more than a guy who knows the science of medicine or the techniques of medicine. He has to be a broad person. He should know something about philosophy, something about history, something about English, literature, and so forth. He should be a broad person. Because unless you're a broad person, in comes to your office somebody who may or may not have an organic disease. Their problems may be entirely emotional, situational, personal, interpersonal. Or they may have organic disease. You don't know until you get to know them as a person and can evaluate all the historical and physical qualities in their story. You don't know.
Did you find that with Georgetown education?
Oh yes, I did.
Did it make you grow in those areas?
I did. Yes, indeed.
Okay.
So that I took an AB course instead of a science one, because I wanted to end up as broad a person as I possibly had the capacity to end up. Not a narrow one. I didn't want to be a narrow scientist. I don't want a doctor who's a narrow scientist. I want a doctor who's a broad human being, has broad knowledge and broad interests.
Phil, when you applied to medical school, this would be 1935, 36?
1936.
1936.
35, 36.
Right in the midst of the Depression. You remember what it was like then to think about education and higher education and why medicine?
Well, as far as the financial part of it was, Father, when he left the White House, had opened a law office in Washington. He had a huge, successful law practice, so there wasn't any problem financially. it was a question of what medical school I wanted to go to. And through my contacts and conversations, travels, going around town, we used to do a lot of traveling between New York and Boston and so forth. The two schools that I wanted to go to were either Harvard or Johns Hopkins, because they were obviously top-notch. And my brother had gone to Harvard Law School, and he had graduated summa cum laude. Matter of fact, he got the highest mark ever gotten by anybody at Harvard at that time. He got one of the highest marks ever achieved. He was a brilliant fellow and a wonderful guy, just terrific. And so I didn't want to go to Harvard Medical School and have his shadow falling on top of me.
Okay, okay.
So I decided I wanted to go to Hopkins. So I came over here, and I had a rough time being interviewed by the
What was that
by
like?
the three deans.
No, come on,
Oh,
tell
it
us. What was
horrible.
that like?
You know about this because you run the dean's office, the admissions office. Well, the first one I went to see was he was one of the senior members of the faculty. He was a dean, and he was an elderly man, and he wore a hearing aid, an old-fashioned hearing aid in his right ear, and it had a long wire, came all the way down, and was sitting there. When I went into his office, he was sitting there in a chair, a nice, comfortable chair, and I walked in, and I said, "Oh, Dean so-and-so," I won't tell you his name, "so that's a delight and a pleasure to meet you." And he said, "Tumulty, nice to meet you." He's a little bit cold. And then unfortunately, the buttons here on my sleeve got caught in his wire and pulled his hearing aid right out of his ear onto the floor where it busted. And all he kept saying all the rest of our interview was, "Tumulty, you've made me deaf. That's what you've done. Tumulty, you've made me deaf." It was awful. It was horrible. But just, "Tumulty, you made me deaf." So after about 10 minutes, I evacuated and left. And then I went in to see the next dean.
What did he say when you left, other than you'd made him
He
deaf?
just kept saying, "Tumulty made me deaf." That's the truth. He didn't say another word. So I thought, oh, my God, I'm not going to get into Hopkins. So then I went to see the next man. And I didn't know it at that time, but I found out later he was an agnostic, strong agnostic. So he came in and said, "Tumulty, sit down. Nice to meet you." I told him what a delight it was to meet him. And he said, "Where'd you go to college?" I said, "I went to Georgetown University." He said, what are some of the things you studied?" And I told him English and literature. Then I said, "One of the things I enjoyed most was theology." And he said, "Theology? Why did you enjoy theology?" I said, "Well, Doctor, I think that every human being should know as much as he possibly can about God and creation. And I wanted to learn as much as I could about God and creation." Right. And he said, "Tumulty, I'm going to give you," he looked at his wristwatch, "I'm giving you exactly 5 minutes to explain to me how you could possibly believe in God and creation. 5 minutes. Give me a couple of good reasons for believing in God and creation." So, oh my God. So I started to explain, and then he was getting sourer and sourer and sourer. So I thought, this is impossible. So I bowed myself out. Then my third interviewer was a very nice guy, and we had a good time. But I went home back to Washington feeling that I was sunk. I wasn't going to get into Hopkins. And I was amazed a few days later when I got a letter saying I'd been admitted. But then I found out also that my father had been doing some politicking on the telephone with some very important, very wealthy clients. Now, whether the third man got me in or whether the clients got me in, I don't know, but I got in.
I think anybody who can stand up to adversity belongs in medicine, Phil, regardless of how they get in.
That was the most adverse afternoon I ever had in my life.
Was it the same then, this thrill, when
Yeah.
you know that you're accepted to medical school, the letter comes?
Yeah.
What was it like? I mean, was it really exciting?
Oh,
or
I
was
was just ecstatic.
It was.
Because I wanted to be, I knew by that time that I wanted to be a doctor.
Yeah.
And to be able to come to this great place, it was way up there. Stars. Oh, I thought I was in heaven. And I loved it.
And your politician father and your lawyer brother, did they think you had lost sight of the right things or not?
They were all for me coming to Hopkins. They were all coming for me to come to Hopkins.
Okay, let's go to that fall. What happened when you came, Phil?
Well,
what did you really find when you came to medical school?
I would have to say this, that from the time I started medical school here till today, I've been in love with Hopkins. I've been falling in love. I fell in love quickly, and my love's just gone higher and higher. Because there's something about this place. Well, it's excellence, number one. There's a reaching out for excellence. I mean, here at Hopkins, we know we're not perfect. We know we're not excellent. But I think everybody in this staff, faculty, nurses, technicians, everybody on this staff, reaches out and tries to be the best. And I quickly got that feeling that everybody there wants the best, and they're reaching for it and striving for it. And that's what I believe in. I believe in that. I believe in that. I mean, every day we try to make the best of today. But I got that feeling, and I just loved it. Then the other thing is I found everybody so friendly, so helpful. I remember during my student days and so forth, some of the big names on our faculty, they all had their doors open, welcoming students in. If you had a problem, go sit down and talk about it. You know, it was marvelous. It was marvelous.
Phil, when you went to medical school, there were 500 credit hours required in anatomy.
Right.
And you would sit there, I presume, for hours, grueling and dissecting.
It was awful.
And then the queen of the clinical sciences was pathology, the same kind of anatomical orientation.
Right.
What was it like?
It was rough, because we had 6 students working on a body.
Yeah.
For each, they had a body for each of 6 students. And you had these bodies. We had about 8 bodies in our classroom, and the rest of our class was scattered around other rooms. But in our room, we had 8 bodies. And you start off the first day with this great big dead body. They got it from the morgue, and you start dissecting it. And we rotate around the body. Today you'd be on a leg, I'd be on an arm, somebody else would be on a head, somebody on a chest, somebody on an abdomen, and you'd rotate around. And then the professor and his associates would come around in the structure and ask you questions. Well, what's that, Tumulty, you know? So forth and so forth. And you did that week after week after week till you dissected the entire body.
Do you remember your feelings when you first met the
was
cadaver,
rugged.
Phil? Remember?
Yeah.
What was it like when you first met the cadaver?
Well, I had been dreading it, as the whole class had been dreading it. But, you know, just made up your mind you had to do it. Now, a few of the students fainted, and a few of them threw up. But most didn't. I mean, they just steeled themselves. Then after a few hours, you accommodated yourself to it. The smell was not very good. But you had to do it, and you did it. You had to do it, and you did it.
Was that the right way to be introduced into medicine and management of illness and disease?
Well, I think it makes sense to know that you have to understand the structure of something before you can begin to learn anything else. I mean, I don't think there's much sense in knowing about the chemistry of the adrenal gland if you've never seen an adrenal gland. You know?
Okay.
I think structure comes first. Structure first, function second. And then third, drugs that can affect structure and function.
In that first year of medical school, what were your classmates like?
Oh, they were wonderful.
They were wonderful.
They were wonderful. They were close friends. We backed each other up. We helped each other out. Oh, yeah. If somebody got in the spot, you'd help them.
What was, you don't remember tuition, but how did you all survive? What was the economic pressures in going to medical
The pressures in those days were not nearly what they are now.
Mm-hmm.
Not nearly. Then, as I mentioned, Father was able to take care of all of this. I never was aware of that being a problem.
That was never a big issue?
That was not a big issue.
Okay.
Now, we lived in, you lived in one or two places, little boarding houses. I lived in a little boarding house. And then we had fraternities. We had 8 different fraternities, and we ate in the fraternities. Some of the people lived in the fraternities. I didn't like living in the fraternities. I liked living in the boarding house. But we ate in the fraternities, and we had a good time.
So there really was kind of this sense of communion. You were together all the time.
Oh, tremendous. Now, one other thing that's different then, in those days, I never remembered for 1 second hearing about drugs.
Yeah.
Nobody took drugs, and nobody took much alcohol. You might go out and have a couple of beers occasionally, but alcohol and drugs were not a problem in those days.
Can you tell me about women in medicine?
Well,
you were going to school?
In those days, there were hardly any medicine. And I'm not even sure we had any women in our class.
Right.
I don't think we had any women in our class.
When you hit the second year,
Yeah.
and then we run into Arnold Rich and pathology. Can you tell us what that was?
Now, Arnold Rich was a man of tremendous abilities, and his contributions to medicine were earth-shaking. He's a great man. And this is a little example of what Hopkins used to be like. I got an idea about renal hypertension, mechanisms of renal hypertension. And I went to see Dr. Arnold Rich, and I knocked on his door, and he said, "Come right in, Tumulty, come right in." So I went in and sat down. He was very charming and gracious. So I sat down, and I said, "I wanted to tell you about some ideas that I had about renal hypertension." He said, "Go right ahead, Tumulty, take all the time you want." I got all afternoon. So then I told him about my ideas, and he said, "That's a fine idea, and I'm going to give you a room in my laboratory, and you come on in and work on that idea. I'll give you all the equipment you want, give you the animals, all the equipment you want." So he took me around to his lab, gave me a place, introduced me to everybody in the lab, and I began to work on my experiments. And then for the next 3 or 4 months, I used to go up there every time I had free time and work in his lab. And then he'd say, "Tumulty, how are things going? Let's go talk about it." And I'd give him the progress notes. Well, nothing ever came of it.
Except the association.
But the association was terrific.
Yeah.
We became great friends.
Right.
And I admired him. And this chance to meet him and talk to him and get close to him, it was a marvelous experience.
What about the clinical years in medical school, Phil? What were they like? Now we're just in the late 30s.
In medical school.
In medical school.
They were very, again, good. The students, we formed teams, and the faculty was superb.
Mm-hmm.
They were marvelous. We had people like Ben Baker and Ward Allen, Murray Fisher, John Eager Howard, just top people in American medicine were our instructors, and they were marvelous. And they were all people that when we made rounds with them, they all stressed the importance, the essentiality of the history and the physical examination, and of working out a plan of management which included diagnosis and treatment. And they stressed the fundamentals. And when you'd introduce them to a patient, when they'd examine a patient, they're always very kind and thoughtful and gentle and supportive of the patient. So you learn this. You learn that being a good doctor is not just being smart or clever. It's being nice and supportive and helpful. It was great. It was great.
Do you think that was called the art of medicine?
Right.
And was that passed by example from the model to the student?
Oh, absolutely. You can't teach that any other way. You can't say, "Here, a book, read about it," or show them an article. It has to be passed. Your students have to see in you qualities that they want in themselves, and then they adopt them.
Did you remember this ever being discussed in psychiatry, or what was psychiatry like at this time?
I enjoyed psychiatry.
You enjoyed it?
I enjoyed psychiatry. Matter of fact, for a time I thought I might become a psychiatrist. And I took a special course in, Adolph Meyer was here then, and I took a special course one whole summer in psychiatry. And I worked over in the old Meyer building, the old Meyer unit, with the patients in psychiatry who were most severely ill. And we had some really fantastic experiences.
What about surgery, Phil? Do you remember any recollections about surgery in those years?
Oh, yeah. Alfred Blaylock was here.
Okay.
And as a matter of fact, I had some interesting experiences with Dr. Blaylock. I took care of Mrs. Blaylock for years before she died. And she was a dear person. This is the first Mrs. Blaylock. She was a dear and wonderful woman, and I loved her. And I used to go down to their house. They had a lovely home in Guilford. I used to go down to their house and see them, the visitor, every day, every week. Not every day, every week, to see how she was making, what kind of progress. And she was rapidly going downhill. And then finally she began to die, and we brought her into the hospital. And Dr. Blaylock and she were very, very close. But anyway, we had to bring Miss Blaylock into the hospital. And it was obviously that she was dying. And, oh, he was just frantic. And he kept coming in and out, and in and out, in and out of the room. The house staff and I were working on her. She was bleeding from her esophagus. We were working on her. And she kept coming in and coming out. He kept coming in. Why would you do this? Why would you do that? Have you checked this? Have you checked that? It was awful. So finally, the chief resident, I'll never forget this, he turned to Dr. Blaylock and he said, Dr. Blaylock, can I give you a piece of advice? Dr. Tumulty and the rest of us know exactly what we're doing. We're doing everything we possibly can for your wife. Your back and forth, these remarks you're making, are not helping us. They're not helping her. If I were you, I'd go up to my office and keep quiet and wait for Dr. Tumulty to call you. And I said, oh my God, the place is going to fall in.
Yeah.
This great man being told this. And you know what Dr. Blaylock did? He said, you're right. And he goes up to his office. He said, call me, let me know.
What happened to the resident?
But he accepted it very, very well.
Did Mrs. Blaylock make through that?
No, she died.
Yeah.
She died that morning.
Yeah.
She died that morning. She's a dear, wonderful woman. I loved her.
Yeah.
But surgery was excellent. Surgery was excellent. The people that I trained with in medicine that were in surgery went on to become the leaders of surgery in this country. They became heads of big... Matter of fact, this resident that said that to Dr. Blaylock, he became professor at one of the biggest surgical places in the country.
Good.
They're brilliant.
Phil, I'm hearing a man who's in medical school, who loves people, loves psychiatry, admires surgery, and yet he goes into a discipline called internal medicine. How did that happen?
Well, I like general internal medicine.
How did that happen?
Because, well, I didn't like psychiatry because I like to deal with human beings and I like to deal with human problems and personal problems. But it was too much that way, because I like to deal with organic disease too. So I thought general internal medicine, and then I don't like to do things to people, technically speaking.
Okay.
I like to talk, as you can gather from
Okay.
our conversation today. I like to talk, but I don't like to do things to people. I don't like to shove things in and up and down them. And so I didn't want to go into surgery. So the area where you could deal with human beings and deal with organic disease, but at the same time personal, interpersonal problems was the general internal medicine. And that's why I wanted to go into general internal medicine.
And you stayed at Hopkins for the internal
Yeah, I
medicine?
stayed in Hopkins for the whole thing.
Okay. Do you remember...
I became Dr. Longcope's first resident. Dr. Longcope's last resident.
Right.
I became his very last resident. And then I became A.M. Harvey's chief resident for 2 solid years. I was resident for 3 years.
Either you did a good job or you failed, Phil. One of the two. What,
I loved it.
1939,
Right.
1940,
40.
You're going into, not quite to World War II.
Yeah.
What was the ward life like? What did the young intern, the young house officer face? Who was on the
It was
wards?
entirely different than now, believe me.
What was it like?
We only had 12 interns on the whole
Right.
service.
Right.
And we only had 5 wards. And one ward was for black females, one ward was for black males, one ward was for white males, and one was white females. And you couldn't mix them up. You couldn't put, if a sick black female came into the accident room and all black females' beds were taken, you couldn't put her on a white ward without the permission of the director of the hospital. I mean, this seems fantastic. The segregation that went on then was unbelievable. And we all took it as a matter of fact. You know, you can't mix up the blacks and the whites. It's unbelievable now. My conscience strikes me. But we all did it because that was the way to do it. Now, in a few years, that all changed. Then we had, the 5th ward was for infectious diseases.
Okay.
So we rotated around those 5 wards. Then we also went to the outpatient department, the accident room. That was the rotation.
What were the patients like?
The patients
What were the illnesses they had?
They were same sort as wonderful clinical material for learning. They were very common diseases mixed in with very, very uncommon diseases. And our major supply of patients is a local neighborhood,
right.
just as it is now, But we worked day and night. There was no time off. You worked 7 days a week, 24 hours a day. You could sign out to each other for a few hours, but that's all. There's no rotation like there is now. You worked 7 days a week, then no pay. No pay. We didn't get paid a cent. Didn't get paid a cent. Even as residents, we didn't get paid a cent. Well, Harvey...
Board and room. You were given a place to live.
Yeah, I had
meals.
My office was... I was very proud of my room, not my office, my room. I had Dr. Oster's old office on the 3rd floor of the administration building, right above the statue. I had that room for 2 years, and I loved it. A beautiful room with Oster's memories all in it. It was his room. But we had no money, no pay.
No salary.
No salary.
No time off.
No time off.
In this program for 3, 4 years.
Yeah, right.
Why did people do it, Phil? Why did you do it?
Because we loved it. We loved it. The team we had was fantastic. The guys on the team, we backed one another up. We all liked each other. We worked like this. And then the instructors we had, the visitors, like Ward Allen, Baker, and so on, they're all marvelous. We didn't have any weak sisters at all. And the clinical material was fantastic. And then the students that we worked with were Hopkins students, and they were wonderful too. I mean, it was very... We worked ourselves hard as the dickens, but we were all happy. We all loved it.
How was it? It was almost vows of chastity. You couldn't be married. You were getting
we got married.
How did you get married, and how did you get? What was the policy towards?
My wife and I got married. We had. Where do you hear this one? During my residency, we had 1 child a year for 4 years. So we lived in a little house in McElderry Street, a little fallen down, terrible looking place. It was awful, but we loved it. We loved it, and my wife was fantastic, a wonderful sport, and the other wives were wonderful too. They formed a team, just like we had a team. They had a team with their children, and they'd sit out in the little steps, the little wooden steps, you know. Remember the little wooden steps in Baltimore?
Oh yes.
They'd sit on those and have little tea parties and all that kind of thing. Take the kids out and have fun with them and so forth. And then our big night was once a week. One night a week, we'd go to a little drugstore on the corner of Wall Street and have supper in the drugstore, sitting at a little table. Then we'd walk up to the movie, the same old movie that's up there still. We'd go to the movie. So supper and a movie.
That was night out.
That was the big night out. That was the big night out. And we'd get a nurse to come in and take care of the kids while we were gone.
How did it happen that you were considered almost the chattel of the head of the service, and you had to have their permission if you wanted to get married?
Oh yeah.
How did that happen?
I had to get permission, not only the head of the service, but the head of the hospital. I had to get permission.
Did they grant it willingly?
They did.
They did.
They did.
Uh-huh.
I had no trouble getting it, but you had to get permission.
How did that happen? What was the purpose of making certain that your whole life was committed to medicine? Women were a distraction?
I guess that's right.
And family was a distraction?
Family was a distraction. But we had a nice big one.
I guess.
Then we had our 5th a year later. So we had 5 of them.
Phil?
But my wife was and is a superb person who could handle any kind of a situation and handle it well.
What happened in World War II? What happened to Hopkins? What happened to Phil Tumulty?
During World War II, as soon as the war broke out, they started creating 2 general hospitals, 18th General and 118th General. And all of us volunteered to join those hospitals. You joined knowing you were going overseas. That was the understanding. If you got into the 18th or the 118th General Hospital, you were going to see service overseas.
So the Hopkins faculty formed their own?
Hopkins faculty formed their own 2 hospitals.
Who was left to teach?
The people who couldn't get in the Army, people who had physical ailments and so forth, the older ones, too old or physically not able.
Okay. So there was a real sense of patriotism?
Oh, there was.
Okay.
And so I joined up. I was an intern. I joined up. We got sent over to the Fiji Islands, and we sat there month after month after month in tents. All we had was tents and folding cots, but tents, rain pouring down. We lived in shacks made out of weeds and old trees by the natives. We lived in these shacks. Food was terrible. We didn't have any food. You just had the routine stuff that the Army provided. And then no patience at all.
Boredom.
Just awful, just boredom. We played chess, we played dominoes, we went walking. It was awful. Played bridge. But we're great friends. We had a marvelous time. Finally, they had fighting on one of the islands nearby, and we got flooded, absolutely flooded with patients. Just hundreds of patients came. Ships would come in and they'd unload them. We'd get 120 patients at a time. One afternoon they'd come in, floods. They put them in these miserable tents with the rain pouring down. And they had wonderful nurses too. We had Hopkins nurses, all Hopkins nurses, all Hopkins people. The Hopkins nurses were wonderful. And then after this flooding for a couple of months, then it all stopped and we had nobody again. We just sat there. And I'll never forget the day that the flood disappeared, they came in, and what do you think they did for us? The Army medical group. They built us a new hospital. We had no patients to put in it. They built a new hospital. Spent a lot of money.
World War II comes to an end, Phil.
Right.
And what happens?
Well, then I came back here.
All right.
And Dr. Harvey had been made professor of medicine. And he asked me to become his chief resident.
Now, this was the rebuilding.
This is the rebuilding.
Hopkins had been gutted for
That's
4
right.
years.
So
The
everybody
faculty
came back at
overseas.
once.
Yeah.
Everybody comes back.
Yeah.
So Harvey was professor, and he asked me to become his chief resident. And I was very thrilled when he asked me to stay on for the second year. So I was his first chief resident for 2 solid years. And he was a marvelous man. He is a marvelous man. Brilliant, fantastic clinician, and a delightful person to be associated with and to work with. He was very sensitive about the students and about the house staff. And he built the staff up to a very high level. And he's responsible for the redoing of the whole show. After I finished my residency, Dr. Harvey asked me to work with him in building up a clinical practice.
Right.
So he was a well-known man by that time. And we got patients from all over the country, really all over the world, came here to Hopkins to see Dr. Harvey. But the way we worked our practice is I saw the patients first. I did the history and the physical exam, and then brought them in at the hospital and took care of them on a daily basis. Then he and I made rounds every day at some time that was convenient for him. And we went around, saw all the patients, and he would check the history and check the physical and so forth, and follow their course with me. So that I had, for a long, long time, this tremendous privilege of working with him day to day in the care of these patients. And they're fascinating patients. Well, a lot of them are functional illnesses too, but very, very good learning cases, and I worked with him. Then we had 2 services in those days. We had the Oster ward service, which was very popular, and students and house staff loved it. Then we had the Marburg private service, which wasn't doing well at all. It was hard to get anybody to work there.
Okay.
The students didn't want to work on the private service. The house staff didn't want to come. So Dr. Harvey asked me, could I take it over and see what we could do with it, see if we could remake it. So I became head of the Marburg Private Medical Service, and I was head of it for a number of years. And the things that we did were simple, but they were effective. We passed a rule that no visiting physician could leave an order on a patient without going through the house staff first. The house staff had to leave all orders, day and night, and the visits had to work through them. This brought them close together. That helped a whole lot. Then the next thing that we did, I picked out some of the best teachers, like Ben Baker, Ward Allen, Murray Fisher, Johnny Guy. I picked out some of the best teachers and set up ward rounds on the private medical service, which were exactly like those on the Oster ward service, where they went and saw all the patients, even though they weren't their patients. They might be your patients or my patients, but they'd go do a history and physical and teach from these patients and make daily ward rounds. And these were tremendously popular. Then I started making rounds myself with the students. And in a very little while, the Marburg service was on a par with the Oster service. And we had just as good applicants, just as many and just as fine applicants for the Marburg private house staff as we did for the Oster house staff. And the students were clamoring to get in there, to be clerks. And it got so competitive with the Oster service that we combined them. Mm-hmm. And we no longer had a private medical service, but just had a single Oster service. So I was out of a job.
You worked yourself out of a job.
Because the job was successful, I lost it, because there's no more private service. So then, in those days, I used to travel all over the country giving talks on lupus and scleroderma. And
now, you didn't develop that. Tell us about how you became a world-recognized physician, in particularly expertise in connective tissue, collagen, and vascular
it's just something that Dr. Harvey and I got interested in together. And I liked, as I mentioned before, I liked general internal medicine, and so did Mac. Mac likes general internal medicine. He doesn't like any just one single specialty. And of all of the diseases that I know of, the ones that give you the most general knowledge are connective tissue diseases. I mean, a patient with lupus can have diseases of the central nervous system, the skin, the joints, the lungs, the heart. Every organ of the system can be involved. Same with periarteritis and scleroderma. So that these general disorders are tremendously exciting to study because they're polyorgan system. Mm-hmm. All the organs are involved, and it can be involved in a variety of different ways. And we got a big bang out of that. So he and I began to write papers on lupus, scleroderma, and so forth, and so forth. And I used to travel all over the country giving talks on these things, and at different postgraduate meetings. And one of the things I learned after doing this for a couple of years was that most of the meetings I attended and talked at were not very good. A lot of the teachers weren't very good. A lot of the subjects were not well selected. The programs were not well planned. And I remember how when noon would come, you'd have to go out to some restaurant someplace and get lunch, then come back again. These postgraduate courses were as much fun as going to high school class and sitting in a classroom. They didn't have any collegiality to them at all. So 33 years ago, I decided I'd like to start here at Hopkins our own postgraduate course, the topics in clinical medicine, where we would have excellent topics, excellent speakers, careful selection of speakers and careful selection of topics, and then collegiality. And we'd have coffee breaks every morning, coffee breaks every afternoon, delicious lunches, I mean really good lunches. And then we'd have a cocktail party on Monday and a dinner and cocktail party on Friday night. So we'd bring everybody together. We'd become friends, not just teachers and students, but kinship, collegiality. Mm-hmm. So 33 years ago, I started the topics course. And it immediately was a success because no place in the country other than Hopkins were they offering such a course. And it was an immediate success, and then we kept it going for 33 years. Now, Dr. Stobo and Dr. Hellman are running it.
We're talking a bit now about recognition as an expert in a very difficult area of disease. You skipped over some of the others that where your signature for time, Phil. infectious endocarditis?
Yeah, oh, I love infectious endocarditis, right.
Anything you want to throw out on that?
Well, again, in infectious endocarditis, if you don't understand that disease, you think of it as presenting as cardiac manifestations, but that's wrong. Infectious endocarditis may present with the same complexities as lupus. Because you have an infection on the heart valve, it doesn't mean that the disease is going to present as an infection on the heart valve. It may present as a rash, as joints, mental, central nervous system, kidney chain, and so forth. Again, it's a disease that challenges you in a broad way, and that's the kind of disease I like.
The thing that I guess I'd like to bring to attention is the change. The change not only in the art to the science of medicine,
right.
The change of the 60s, the change of the 50s. What happened to the wards, the integrated medical system? Did women get into medicine?
Yes.
With all those things.
Well, fortunately, the integration thing just evaporated, and it all became one again, and color didn't make any difference.
How did you see that, Phil? What was it like to be involved in that change?
Well, I think we're all tremendously relieved and tremendously happy, and wondering why in the world hadn't we done that before, and how could it have been so ridiculous? So we're glad. And then we're very happy to have women come into the picture too. These are sort of things that should have happened that now you're glad they've happened. Now you're glad they've happened.
Okay. Looking back over
But they just happened naturally,
okay,
so that you didn't think a great deal about it. You didn't think, oh, well, think all the new things that have happened.
Did we lose something as we gained something? Did we, by beginning to put money, salaries into medicine, taking Medicare money and putting it in to pay for the salaries of our house officers, and they began to move away from the hospital, we gave up that never-ending call system you talked about? What happened?
Well, I think I personally think the on-call system that we had was better than they have now.
Why?
For patient care.
Why?
Because I think if you're my patient and you're sick, and you wouldn't be in this hospital or you wouldn't be very sick, but you're quite sick, and something happens to you, I ought to come see you and not send my friend or my associate over to see you. I think I have this responsibility to take care of you. No matter whatever happens to you, I ought to be there to meet it.
And with the current system, are we training people? That's not important.
Well, they sign out for periods of time and so forth, during which they don't respond. Now, I'm old-fashioned, and I'm sure it's going to sound ridiculous for me to say this, but I suppose you had to sign out sometime, but I don't think they should sign out very frequently.
Do you think that we've gone too far with the technology of medicine, the kind of public outcry that they really want?
Well, one of the big changes that's occurred when I was coming along, a doctor was a god. A doctor was like a priest.
Yeah.
He's a great person. And certainly people don't feel that way now.
Right.
People don't feel that way now. And I think the big change that's occurred is doctors don't communicate like they used to. They don't communicate. I mean, I know members of my family go see doctors, and then I say to them, well, Kathy, what did Dr. So-and-so say was wrong with you? Well, he didn't say much at all. He gave me some prescriptions, you know? And obviously she hadn't been indoctrinated. She hadn't been instructed. She hadn't had communication about what's wrong with her and so forth. And that's a shame. And then 40% of all illness that an internist sees is functional in origin. 40%, at least 40% is functional. And you can't take care of functionalness in any way except through conversation, through communication. I've got to get to know you as a person, and I have to develop a relationship with you that's interpersonal. And we have to sit and talk. We have to sit and talk. And I can't just come in and thump you once or twice and stick something up your behind and so forth, and then send you on your way with some prescriptions. Medicine has become too scientific and too technical, and not enough communication, not enough personal interpersonal.
Phil, one of the purposes of this interview was to give a role model for
Yeah.
what you're
Yeah.
saying. How do we get this message? And if we think it's important for the young people, we get it to them,
Yeah.
but also to the establishment of medicine.
Right, right. I think that's right.
How
I
do
think that's right.
we do that?
Well, I just think by plugging along, for example, if you read I look at the New England Journal every week, and some of the other popular journals, they don't have clinical articles in them anymore. They have article after article, which is highly technical. But do you ever read about the kinds of things we're talking about now, interpersonal, situational problems, and how to handle it? You don't see that stuff. You don't.
The last place I saw that well
Yeah,
done was
yeah.
a book by Phil Tumulty
Yeah,
on the
right.
management of disease.
You just don't see it anymore.
Are you going to do a follow-up on your book on management?
I've been asked to be, and I
Okay.
plan to do it, yeah.
I hope that you will. I think that's long.
I'm looking forward to it. But I think in medical school and hospitals have got to stress the fact that a doctor, I've said this now so often you're sick of it, but a doctor has to be the following things. He has to be a scientist. He must be a scientist, and a good one. He must be a good technician. But also he must be a communicator. He must be a communicator. He must be able to communicate with people. And then next, he must be a person that plans the patient's management. Plans the patient's management. Management's the big word. Diagnosis is not the big word, and treatment is not the big word. Because you may have a patient, you may have a disease that we can't here now diagnose, or you may have a disease which we can't here now treat. But we have to manage it, which means we take care of all aspects of it. We take care of the medical aspects, we take care of the personal, the interpersonal, the social, the financial, and so forth. We take care of all aspects of your disease. That's what a doctor is. And that's the kind of doctors we have to produce.
The point is getting late in the
Yeah,
in
right.
the interview, Phil.
Right,
And I think we've covered a broad spectrum.
right.
I thank you for sharing with the viewers of this film the perspectives of a physician who is the best of the art, made the transition into the science, and never once got muddled in the values that are important to becoming the clinician's clinician. On behalf of my colleagues here, Phil, thank you for a career that we admire and trust. You will always be our doctor.
Thank you so much. And I appreciate your comments enormously, and I enjoyed being with you so much. Bless you.